Welcome to the next episode of Diagnosis. A young man is found in his home, exhausted, nauseated, and battling a severe headache. Worried by his worsening state, his mother rushes him to the hospital. Inside the hospital, a resident is gathering supplies from a rack when, suddenly, a rat leaps out. Startled, she screams and bolts down the corridor, running straight into the chief's room where her co-residents are gathered. Breathless, she recounts the entire encounter. The room bursts into laughter, amused at how terrified she was of a tiny rat. Before the laughter settles, a nurse opens the door and announces a new case. The same young male who arrived moments earlier. The chief and residents immediately move to examine him. On physical exam, one finding stands out unmistakably: jaundice. The chief begins outlining the clinical picture. The patient's labs soon return. Liver function test rises calmly. Greater than, this is acute liver failure, coagulopathy, encephalopathy, and renal dysfunction. The residents begin listing their differentials. Resident 1-1, acute viral hepatitis, severe 2, alcoholic hepatitis with acute on chronic liver injury. But no stigmata of chronic liver disease, AST/ALT in the thousands. Not typical for alcoholic hepatitis. Resident 2-3, autoimmune hepatitis, autoantibodies, -4. Wilson's disease, fulminant, ceruloplasmin. Normal, no Kaiser-Fleischer, rings 5. Leptospirosis, dengue with hepatic failure. Soon the serology results return: hepatitis A, IgM, negative hepatitis B, negative hepatitis C, negative leptospira, IgM, negative dengue, NS1, negative ceruloplasmin, normal autoimmune markers, negative. Despite investigations, the patient deteriorates rapidly, worsening liver failure, rising creatinine, now requiring immediate dialysis. The chief grows increasingly concerned. He picks up a small ball on his desk, and as he plays with it, a rat suddenly hops onto the table. The same rat that terrified the resident earlier. In that moment, something clicks, a spark of clarity. The chief realizes this isn't a natural disease. This is poisoning, rat killer poisoning. He sends the residents to the patient's home to search for clues. They comb through his room until they discover a tube hidden in his drawer. Rutol paste. Confronted, the patient finally admits the truth. He consumed the paste deliberately following a painful love failure. Ashamed, he had concealed the history. The chief then explains the full picture to his team. Classification of rat killer poisons. Given the severity of yellow phosphorus toxicity, the chief concludes he needs urgent liver transplantation. Supportive care alone isn't enough. Before the team disperses, the chief shares one final lesson, a reminder every doctor must learn early. Investigations are important, but history is everything. And remember, patients lie.